Hi, I'm Alison Weidner. I'm a urogynecologist in the Department of OB-GYN. I think a number of us have observed this, but because of the nature of what we do, we find that we are often taking care of women who have lived through the Great Depression. They've been through all the social and economic upheaval of World War II, and they really are members of the greatest generation. And we find that when we come in and see these women in their 50s, 60s, even into their 90s, they've seen and done a lot, but yet they are here because they perceive that we can help them do more. And what we find most gratifying is we find that many of these patients are tremendously grateful for the things you can do to allow them to resume what they would regard as a full life. I think a patient would do well choosing the Duke practice here in our office because we've made a real point to foster a welcoming atmosphere, an informative environment, a place where a patient can really get top-flight care, coupled with a sensitivity to the issues that we're talking about, and an understanding that these are complex decisions that patients are trying to make, and that they need some guidance and information. A lot of patients are very well educated. They know what's out there. They know that that some of these conditions and procedures are sometimes not necessarily performed very often by a generalist practitioner, and I think that it's fairly clear that with increased volume and increased focus in a particular area, oftentimes outcomes are better. And we feel like that's what we offer for our patients.